must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everyone, and welcome to another episode of the Healthcare Education Transformation Podcast. My name is Brandon Pollen, and of course, as always, I'm joined by my fellow co-host, F. Scott Thiel, and today I am super pumped to invite one of my fellow DPT classmates onto the show today to talk about his sports residency experience, and of course, many other things, as I'm happy to welcome Jake Awender onto the show today. Now, Jake, thank you so much for coming on the show, man. It's always a pleasure.
Yeah, absolutely. Thank you guys for having me. I'm excited.
Yeah, we're pumped, man. And, so Jake, I know you rather well, but our listeners do not. Do you think you could maybe introduce yourself to our listeners about who you are and your journey that led you to starting PT school at Northern Illinois University?
Yeah, so I'll try and make it brief. I grew up in a small town called Freeport, Illinois. So I'm from Northern Illinois University to begin with. And pretty much my path, I suppose, to healthcare started in sports. I just got hurt a lot. Starting from a young age. I was what you would describe probably as injury prone. So I had a couple surgeries even through high school, and kind of wanted to go actually the doctor route going through college. Kind of changed my mind as I got my second or third year in. And a high school classmate of mine actually also graduated a year ahead of me from college and went to NIU's program, Nate Holmes. And so I saw him going through all that and looked super interesting. And I like lifting, all that kind of stuff. So I was kind of drawn to it for a bunch of reasons and want to stick around town. So there you go. Chose NIU and got in on my second try around. Not ashamed to admit. So it was worth it.
You know, Jake, I know with us being from the same DPT program and cohort, so we graduated from Northern Illinois University's program in 2015. I'm really curious to get your honest opinion looking back from where you are now on what you feel were the biggest strengths and weaknesses of our program.
Yeah, that's a good question, especially thinking about maybe how I would have answered that as a student. I'd say we'll start weaknesses to end on the positive there with the strengths. I'd say the weaknesses of the program then, it seemed, understaffed. I think we had very good professors. At the time as a student, you're prone to maybe throwing a few complaints amongst each other about your professors and tests and questions and stuff like that. But now being separated from it and still keeping in contact with them, I can't speak for PT programs in general, but NIU's then seemed really understaffed. The director had to teach a bunch of classes. Clinical staff was teaching a lot of academic classes, stuff like that. I think that was a big, I don't know if it's a drawback, but I would say it's something that I think has been remedied, so it must have not been ideal. And then also I'd say I'd actually even go back to undergrad. The lead-in, I was a pre-PT major, and I really think the preparation as an undergrad for the pre-PT school was not quite adequate. And I can't speak to what that's like now, but I do recall, and this is true, making a collage my last day of undergrad, Mr. Dean's List. How do making a collage with a blunt nose, scissors, and a glue stick, getting my bachelor's degree, going to PT school. I could have been prepared more, I think, before going in. Kinesiology, a few other classes too, I think were reserved for certain majors like ATC. It's a great program for ATCs, but we couldn't get access to it. Limited anatomy courses when you're going to be doing that. So, and that's a university level thing, less so than the clinical doctorate thing. So it's not really the PT program's fault. I'm sure they'd like to change it. But I would still consider it, unfortunately, a drawback, but still a great school. So then unless
strengths.
Yeah, so the strengths, there you go. I don't want to be all negative here. The strengths, I think, definitely orthopedically at the time, if we're going to talk topics or categories of PT. Orthopedically, I think we had a really great staff. Mike, who was initially our ortho guy, did a good job introducing us to the foundational stuff. And the teachers and our professors, despite being, I would consider, overworked, I mean, they worked. They didn't have too much to do and not follow through. They worked really hard for us. But overall, I would say by far the biggest strength of the program is that internal physical therapy clinic that we have just off campus. It's a beautiful campus, or a beautiful clinic. It has everything you need. It's staffed by still quite a bit of Joy and Bryn, and even a couple others now who you can't find CIs like that just anywhere. So the instruction you had in the clinic and just having one, as everyone who's a PT out there listening knows, you can learn how to do things from a book, but especially in healthcare and a lot of other jobs, I'm sure you have to do it 1,000 times over and over and over, and getting exposure to patients, getting used to your first evaluation. What am I going to say? They answer you. How do you respond? Because you're so nervous. So getting that out of your system before you even go to an external clinic, and really having, as long as there's patients, you can go treat them. Unless there's a long line of students wanting to, they're there. So that is invaluable. And that's hands down the biggest strength. And it's a good one with that program.
I agree, man. And I think just to add on to that, I'm going to be biased here, but that was honestly when we had to teach a second year student, or kind of be like unofficial CIs our third year.
Yeah, I was right after you. I remember you were always there when I got there.
I know, that's right. That was by far the most fun thing I found in those whole 3 years. And I loved having that opportunity to be able to get involved in that. So
yeah, it was a good time.
All right, guys, I want to go ahead and touch on the weaknesses again in just a minute, because you brought up an important topic that we're going to probably talk about when we have some of the CAPTE people on. But you said that, you seemed a little bit understaffed, with all these new PT programs coming out over the next year or two. I don't know, that there's necessarily a remedy for that. But what do you think are some of the remedies for some of these weaknesses that you saw in your program?
Yeah, I actually, to remedy that, I'm pretty sure, although I have no idea, that first of all, pay isn't that good. And I believe, and you guys may have some insight into this, all the guys you've talked to, or all the people you've talked to, that clinical staff is not paid the same as academic staff, and having to rely so heavily on clinical staff, you're going to take a pay cut probably teaching at a university like that, a state university on top of it. I have to imagine finances play a role in there somewhere. Also, there's not a lot of, I don't think PTs do a great job of emphasizing quality education after graduation. That's maybe I'm biased. I guess I'm here talking about residency. Maybe I'm biased. But I don't think culturally, or would you call it that in PT, a huge emphasis is placed on it. It's almost a lot of CEUs can be for fun almost in our world. So I don't know if there's probably a good amount of reasons, and I don't have the best answer probably on fixing it. I'd have to think about that one.
So Jake, now we've talked about DPT programs. So let's go to the next level here. Let's talk about residency. So first and foremost, man, why did you decide to pursue a sports residency, and what specifically made you decide on the Fairview Sports Residency in particular?
Yeah, well, I got that question during my Fairview interview. So really, the reason I went about doing one, and first of all, I didn't even know PT had residencies until I was approaching like Christmas break of our second year, until someone brought it up to me. I didn't feel comfortable clinically. I didn't have a great experience in my first external rotation, and I'm kind of I suppose self-conscious. I always want to be the best at stuff, and I'm pretty hard on myself and academics and everything, really, like a lot of people are who are, pursuing degrees like that. And I didn't feel like I was good enough. I didn't feel like I got the education, not necessarily from NIU, but from my external clinicals, that I needed to be good. And one of the clinical staff that I was working with in our clinic at NIU, that I did a lot of extra hours with, mentioned to me like, hey, maybe you should look into residency. I was like, what are you talking about? So after researching it a little bit, and not necessarily at that point Fairview's, just what residencies were, and of course I was interested in sports specifically versus ortho and acute, anything like that. I looked, I was like, oh wow, that looks fantastic, and that's kind of just almost immediately. I kind of am like that. I just kind of think of something and go. Maybe within a couple of weeks from that, just learning we had residencies, I decided I wanted to do one, and I just started going for it as fast as I could. And then, to answer the rest of your question, why Fairview's? There's a lot there's a wide range of residencies, I'll say. In sports at the time, I think there were only maybe 26 in the country, and 0, by the way, I think 0, maybe 1 in Illinois at all. So it was, first of all, there's not a lot to choose from, or there wasn't then, but they're all very different. You could look at all 26 and they're all, or at that time at least, and they're all 26 completely different programs. So Fairview's had a lot of hands-on mentorship, a decent amount of didactic comparatively at the time. They have a ton, but at the time it looked like, oh, they have a good solid amount of didactic learning and classroom stuff, and affiliations with sports teams, which was very, appealing to me. Of football, baseball, anything you want, it's all up there. Because Twin Cities, once you get there, I'd never been in Minnesota in my life when I was looking into it. And I thought it was bigger than it was. There's maybe 500,000 people within the Twin Cities, but then outside of that, there's not much. So everything that happens medically gets shipped down there. So they see a lot of cool stuff. And the more I read about it, the potential to teach like return to play classes, they have great funding. So technology they had to work with, like in the clinics, when I dug a little deeper, it just looked like hands down the best in the area. Between that one, there's one in Wisconsin that I was very interested in, Indiana, and I didn't end up applying to anything out in California or anything like that. Wisconsin has one as well, UW, but Fairview's was the top of my list.
Yeah, Jake, so tell us a little bit about the sports residency. I mean, what was the application and interview process like, and what advice would you give to interviewees?
Yeah, so the interview was pretty intense. I liked it, but it was pretty intense. So application, it's similar to PT school. It's online. It's similar to the PT CAS. All but one that I noticed. There's one in Tennessee also that I applied to, run by Danny and Justin Smith. They're pretty well known in the sports PT world. They're great guys, and they're more of a call them on their cell phone and apply. Like you get to know them, meet them. I met them at CSM. It was great. So that was a little bit different, but I recommend looking into that one if anyone's interested. That's a lot of sports coverage. But for Fairview's, the interview process, so I remember it very well. So you show up, it's on a Wednesday, all right, and on Wednesdays during the residency, it's either grand rounds or once a month there's journal club. At 7 in the morning. So that day happened to be journal club. So you get there before journal club, you meet the director and some of the staff, and just in the hall across from the auditorium where you have the presentation, or that day the journal club. And, you meet them a little bit. They kind of introduce themselves, tell you what to expect for the day, and you go in and you sit for the journal club. They luckily tell you, hey, man, you don't have to participate. No one's going to grill you, because I was, of course, super nervous. So you sit through journal club. At that point, everybody meets out in the hall again, and you have to provide a 7-minute presentation on a research topic that you'd like to do during your residency. So you're all sitting out there waiting for your turn. You go into the room full of people, stand up and give your 7-minute presentation. Luckily, I went one of the first ones, so I got that over with quick. But then after that, I believe we drive from, that's in Edina, just outside Minneapolis. Then you drive to the main clinic in Eden Prairie, where they have, I'm sure it's the same still. So you're going to go through a few hours at that point of interviews. There's several rooms with 2 interviewers in each room, and you're going to get different, maybe about half hour or so per interview. Different sets and styles of questions from each one. Everyone's super nice. It sounds worse than it is. It's a marathon. So you're going through a bunch of interviews, you eat lunch, meet more of the staff, more of the doctors, things like that. You also have 30 minutes with the current residents. So they relax you. They're really nice. You go for a walk. It's nice outside and stuff in Minneapolis. So come on back. And then at that point, I don't know if we had anything else. It's a pretty long day. And then so you're done around 3:00. So it's 7 to about 3 of trying to be on. You're pretty tired afterwards, but it was a blast. When it was over, I was tired, got a big, large pizza in my hotel room and just went to bed. It was a blast, man. It's pretty intense. And so any recommendations that I'd give to anyone applying for one or going through the interview process, be yourself. I answered the question to Brandon about why, exactly how I did then. I didn't say anything grandiose or try and sell myself. I was like, hey, because I need to learn. I'm coming to you guys to teach me. I'm here because I'm not good enough. I'm not here to be your equal. I'm a new grad, or I would be a new grad. So I think that helps, because I know actually I got a ride to that clinic, and the kid that gave me a ride, we got out. He's like, oh man, I know what they wanted to hear. You want to hear about the APTA and da-da-da-da-da. and he didn't get it. He wasn't there that next year. So that's probably not what they want to hear. Just they want you to be normal. They want to know who they're going to work with for a year and just be honest. And, they're going to get a sense of whether or not you're telling the truth and what your motives are. Or, if you try and hide anything, why would you do that? Just be honest. That's the advice I'd give.
Sure. And were there any prerequisites or anything that was required before trying to apply?
No. I mean, depending on the program, there's a fee. That's about it, though. That's usually the prerequisite for most things. Send a check. So that's about it.
So Jake, just because I know with sports certification, I know it's a little bit different than like OCS, GCS, and all that in terms of, isn't it true that you have to get like a first responder cert or something like that? Is that accurate?
Yes, it is accurate. You have to have an EMR, your emergency medical responder certification, prior to going. Since you're going to be covering so many events, you need to know how to splint, environmental risk factors like heat injuries, cold injuries, all that kind of stuff. So you really want to know what you're doing. They never send you somewhere alone, obviously. You show up green and you're a rookie. So you always have someone to help you. But if you're going to help someone, or if more than one person goes down, which that did happen, you got to be competent and familiar with what to do. So yeah, you're required to have an emergency medical response certificate, which is smart. It's not a bad thing. It's worth the class. It's worth the time and the fee and all that.
Right. And that makes sense. And, to kind of dive a little deeper, I know, Jake, earlier you had mentioned about the mentorship, the didactic, and the research, of course, but let's dive into that just a little bit more to kind of give maybe our listeners a little bit of some perspective on like the ins and outs and kind of how, and like what that really all entailed. So can you think you could dive a little bit deeper into formally the mentorship, didactic, and research and other opportunities that you went through specifically within that residency timeframe?
Yeah, it was a lot and all good. So let's start with mentorship. So you spend time in 3 different clinics at Fairview. So you're at the university clinic downtown Minneapolis, which I loved. You see, that's where all the docs are, obviously, the university MDs and surgeons. So you see a lot of complex cases there. You spend a lot of time there. At the time, it was John Corbo, who was my mentor, great guy. And he spends time, all mentors, you've got blocked time. We had it, I believe, every Friday to just sit down. He sees no patients. It's blocked for him off his schedule. It's blocked for you off of yours. And you sit down and you go over everything from what to do. In this case, you go over all your patients, documentation. They, of course, have to check your documentation, especially being just out of school for me. And then if there's none of that, if it's all been covered, you bring something you want to talk about. There's always people there. And even outside the residency, actual staff, the people at that clinic in particular, when I was there, like Jill Monson was awesome. Oliver Ang was great. Wendy Hurd was there when I started. She's a pretty big PT publications and name. She's at Mayo Clinic, I think now, originally from Delaware. And so everyone there is like an expert in something and willing to help. There's always a resident there. It's not a random thing. So they know the deal. And everyone is always helping you. It's not like, oh, mentorship time is blocked 2 hours on this day. It's, hey, Ken or anyone, Peter, come on, I got a question, and they'll always help you. It's constant mentorship. I cannot emphasize that enough. If you want it, you got it from anybody. So, and they're worth listening to, all of them. So that's big on the mentorship. So yeah, that's at UOrtho, then Eden Prairie, and then up at the sports complex in Blaine, Minnesota. Matt Asama is the mentor up there. He also did a great job. I think it was his first time doing it when I was up there, and he did an awesome job. It's a huge complex. They got a small clinic in. And so that's the mentorship again. Cannot say enough. 100% worth it just right there. All right. And I went mostly for a clinical experience. So you can do a lot there, which we can get into. But that's what I wanted and got it in spades, more than I expected. And then, so didactically, maybe this is my favorite part. I'm going to take that back. Tuesdays with Mary. And that's how Mary Kramer is one of my favorite people in the world now. Every Tuesday, 8 to noon, you go through a class with her, and that's a didactic / lab session. So she's a faculty or teaches for the International Academy of Orthopedic Medicine, and she is hands down the most passionate PT I've ever met. I think the word passion can be overused, but it applies perfectly to Mary. She knows as the answer to most of your questions, and if she doesn't know it, she'll find it. So she taught me and all of us so much because the way it works is at Fairview, there's 2 sports residents and 2 orthopedic residents. And we took all those classes together. We did a lot together. So there's a good amount of overlap, which was nice, seeing both worlds there. And that We went over every single joint. I know we were sports, but TMJ, foot, ankle, knee, hip, ribs, hands, everything. We covered all throughout the whole year with her, and I learned so much. I still keep her binder with me and try to send her an email once a year or so to say hello, because it was fantastic. Again, worth it. And I'm not being paid to say this stuff, by the way, folks. It was a tough, long year, but it was, looking back, at the time when you're in something like that, like, oh man, I'm tired or whatever. No, Tuesdays were the best day, and the whole experience was great. And then, so to continue on Tuesdays, another reason it was a good day, if they still run it this way, right after you get done with Mary's, you go to do training room hours. The sports residents did, at least. So at the time, in the fall, you're affiliated with a football team. So I was with Hopkins High School. You'd spend the afternoon in Hopkins High School, and whenever you're with the trainer, and also a sports primary care MD fellow. So it's 2 sports residents, 2 ortho residents, 2 primary care sports fellows, doctors, and then 1 surgical fellow. And that's kind of a big group of people. You do a lot together. So I was with him in the training room, and it's a big high school at that. There's people coming in, the trainer's with us as well. The doctor's checking them out. I'll eval them, show them some stuff. Oh, and you go back to the doc, I think you might have a this or that or a hamstring tear. He's ordering imaging on the phone in the training room, and it was a blast, man. I mean, you got to go to first day. You just got to do it. And again, you're super nervous, but you get used to it. You're just thrown to the wolves in a good way. You're never alone. But as a nervous new grad, you feel like it. But you just learn so much so fast with that. And fantastic. So you're learning on the gun. Always got a guy to ask questions to, another PT, another doctor, whatever. And so Tuesdays were a good day in the training room and with Mary. And then moving on, what else do we do? So then so Wednesday, gosh, I still got most of my schedule in my head. On Wednesdays, like I said before, it's grand rounds most Wednesdays, and then once a month is journal club, which I loved. So, and it's a sports medicine grand rounds. So we would either be at the IAM, Institute for Athletic Medicine is affiliated with Fairview, or they're a part of Fairview. So it's IAM's grand rounds would be a physician, a PT, someone giving a talk on that. And then after that, Wednesday I'd go into the clinic for another half day. So always doing something, always leaving a room with papers in your hand and stuff to review. And after those talks, we would I can't remember what they called it, but it would be someone coming in to present to us again between grand rounds and clinic. And it was awesome. You go into a different room, smaller room with everybody. You still got your coffee from grand rounds and have another PowerPoint presentation about maybe dermatology, how to skin, taping presentations, everything, the whole shebang there. So constant stuff. And it's a good time. Lots of material. But you have time to digest it too. It's not like you got to do it and you're going to get quizzed on it right away. They say repeatedly, it's adult learning. You got this. If we ask you about it, we'd like you to know. But they're not going to bust your chops about it. If it's laid back yet intense, which was good for me because I could use a little bit of both in my world. So, and then what else? So the didactic section, and then so I suppose this counts. A lot of weekends are spent in CEUs through Fairview. Of course, they're free, and then so a lot of Saturdays, Sundays, especially in the fall. You spend Saturdays, Sundays in the classroom going to see. We did like everything from splinting with OTs to running to everything. If there's a CEU and it was relatable, we did it. Manipulations for spine, cervical spine, all of it. So it's just fantastic. Walked in with dragging feet occasionally, but looking back, it's fantastic.
That's great, man. And just one quick follow-up. How much did it cost for the residency program?
Nothing. You apply to the cost is you don't get paid a full salary. Our salary is about 50%, but we only worked about 50% of hours in the clinic. We were 50% productive. So that's probably fair. You know it going in. It's not, see, they don't tell you when you get there that you're only going to get paid half. So no cost at all with this one, which I liked. And I would suggest anyone listening to look for one like that. It's not going to charge a large fee to do it.
Yeah, Jake, it sounds like just an absolute ton of learning that went on. But what was your biggest lesson that you took away from going through a residency training about sports and rehab or, just PT in general? Yeah,
so the biggest lesson, a lot of people ask me this, especially now doing our mentorship, standards. There's not treating an athlete versus treating a non-athlete. If it's shoulder, let's say anything, shoulder pain, you look at it the same way. Maybe you progress differently, but what I definitely had ingrained in me, because you don't have much of a choice if you want to keep up with the other PTs, with your fellow residents, is standards. How are you looking at things? How are you measuring? Are you testing, retesting? Why are you doing that? That may look, you can go, okay, but you always asked why, no matter what you do. And they're not pushy about it. They just want to know what you're thinking. So standards for your clinical reasoning, hands down, is what was pushed hard there. You could do a lot of things independently. You're a licensed PT now, but why, etc. They just can't emphasize that enough. That's what it took away with, and that's what's stuck.
So Jake, were there any other things that, besides what you had mentioned before about the importance of standards and clinical reasoning and such, and kind of assessing and, progression, are there any other things that you felt like that were really important skills that you got from doing a residency that perhaps you hadn't mentioned earlier?
Yeah. So like I was just saying, we also had to do things like sports injury screens for certain teams. I remember a volleyball team and a basketball team. First thing we ever did was a high school sports physical. So it was our job. It was like my first thing I did in residency. It was like day 2. I got there and they sent you up to do these physicals. I was super nervous. The first thing I did was threw my gum in the linen basket because I thought it was the garbage. And I was like, oh, crap, everyone saw that. I didn't know what I was doing.
Nice start, rookie.
Yeah. Oh, I know. I had my backpack on, so I still remember chucked it right in the towels. But no, so like I just find myself still like less shy and less nervous because it's constantly, hey, resident, come in here and meet this doctor. Hey, come do this, come look at that. And you're like, oh man, all right. You had no idea it was coming. And it's just really helped me, I would say, sounds cheesy, grow a lot personally.
No, I think that makes a lot of sense based on what you went through and those opportunities. That seems very logical to me. Mm-hmm. So Jake, I guess I got to ask now, so now let's switch gears to the target audience being people that are now either about to start or current sports residents. What is some advice that you would give to current sports PT residents to make the most of their experience?
You know what? Almost the end of your sentence. Make the most of your experience. I can only speak because, as I alluded to before, all residencies are different, at least in sports. Some have more mentors, some less. So at Fairview, they really will try and set up anything you want to pursue. If you want to shadow here, you want to travel to here, you can go. There's a couple former residents are now the PTs for Major League Baseball teams. You can go to their training camp. You got to pay your own flight that way, but you can go there. You want to shadow the strength coach for a hockey team here in Minnesota. You can go. If you want to do it, they'll do it. They'll set it up for you. So I work for a baseball team now, but I didn't even see myself doing that. So I didn't pursue all of that. Maybe I should have. I don't regret it because at the time that's not what I wanted. But absolutely, if you've got an idea, and if you're at the residency I went to, go talk to Peter, your mentor or whatever, and they really will try and do it for you. And you're going to learn something. Whether you like it or not, it's a different story, but you're going to have a new experience. If you want one, they'll try and give it to you. You get out of it what you put in. They say that 100 times. So they're correct.
Of course. And Jake, after completing the residency, right, comes taking the board specialty exam. What was your honest thoughts on the sports exam? How did it fit? Was it relevant? Was it up to date?
Yeah, certainly it was up to date. Actually, very much so up to date. I thought it was a good exam. I don't think those exams are meant to tell you how to treat anyone. I don't think that's their purpose. And I don't think you should rely on an exam like that post being licensed to tell you how to treat. So if clinically applicable, that's not necessarily what you'll get out of it. I can't speak for the OCS, but for the SCS, yes, it's very good about what not to do. If you pass the exam, you know how not to hurt somebody after, especially post-operatively. You can write your own protocols if you do well on that exam, which that should be another episode. I would love to talk about that. PTs not knowing enough of protocols. It should be our job. Anyways, but I think the SCS also, it's heavy on sideline or management or sports venue coverage, since that's kind of the direction, you want your EMR to get your SCS. And then that's kind of, it looks like where a lot of people who pursue the SCS want to go. So it's not clinically completely relevant. It's actually the opposite, intentionally so. You have to know your, again, heat risks, cold risks, lightning. I still remember the questions about that. I think it does a good job if you go into it with reasonable expectations.
Gotcha. So Jake, would you say it's reasonable to make a comparison that SCS is kind of like the NPTE, but more for sports conditions?
Yeah, very close. More for sports conditions. Definitely. That's how I would describe it. Yeah.
All right. That makes sense. So I guess
risk factors for sports. I'm trying to run through my brain. Yeah, that's how I describe it.
All right. Nice. So let's take it a little bit of a bigger level further here. What do you feel are some of the strengths and limitations with having a sports certification?
Interesting question. Having a sports certification, I don't think having the certification has a strength or a limitation. I really don't think so. It's nice. Everyone thinks it's, and I agree. It's nice to have letters after your name. Add a few more. It's always fun. Looks good on your cards and stuff. But having the SCS, having probably any specialization doesn't mean much. Doctors don't know what they are. And your patients definitely don't know what they are. So I don't know how much of a benefit having those letters and passing that exam means unless you're going to use the new material. And in an SCS's example, that would be, are you going to cover? Are you going to, et cetera, down the line? So I don't know. I hope that is a reasonable answer to your question. I don't see the letters or even the certification mattering that much, because there's nothing on that exam that anyone can't find out themselves. If you have access to the internet or PubMed or your whatever, there's nothing hidden or secret that's only given to sports specialists or orthopedic specialists or neuro specialists. It's all general healthcare information. They just want to make sure you know your niche. If you know your niche, you don't have to get specialized. I have my SCS because I did a residency. I don't know that I would get an SCS. Nothing against it, by the way. I just don't know that I would get one. I probably would, but I can't say for sure that I'd get one if I didn't do the residency.
Yeah. Now, did you have to pay for SCS from going the residency route as well? And with that, Jake, do you know how much it costs to keep your SCS and how often you have to renew that if that's something you want to do?
You know what? Actually, no. I don't think I had to pay fully for my exam going through the residency. I could even be wrong with that. I don't think I did. And so for the SCS, I'm the bad one to ask, because if you go through a residency and graduate, you're exempt from a lot of prerequisites. So having done that, I didn't even know what the other prerequisites were. I still don't. There's certain things I know, like as far as cost goes, I don't. Aside from having to re-register for the exam in a number of years, I don't think so. Your EMR, of course, costs more than a CPR certification. It covers that too, but that's a bit of an extra expense. And then there's certain hours. You have to cover a certain amount of hours of sporting events and document them if they audit you, as well as treat a certain number of hours of patients in clinic that are athletes or considered athletes to keep your specialization. Other than that, I'm a bad guy to ask. I got to look into that before my SCS expires, I suppose.
Well, you got about, I think, 10 years or so.
Yeah. Well, I'm a bit of a procrastinator, so I still might run out of time.
All right. We'll keep on you then. All
right. Thank you.
So with the upcoming debate over whether residency should be mandatory or not for PTs, I'd like to know your thoughts on if you thought residency was a good investment and why or why not.
Yes, 100% for me. But the question would be, what are you asking? What are you investing? If you're a financial investment, well, that's easy to do the math. No, it's not. Yeah, I have less money now because I did my first year out with 50% salary. That's not why I did it. As far as being a good clinician, being a comfortable clinician, absolutely priceless investment, 100%. But then as far as residencies being mandatory, as they stand now, I would not say they should be. Given the massive spectrum of quality that in my opinion, I'm no expert. I only am an expert in one area or one residency. But there was one that there was 100% minimal. They met all the minimal criteria. I won't even say where it was. And then you have to sign a contract saying you'll open a clinic for them when you're done. And it's mostly for their financial benefit. It was through a corporate PT chain, go figure. So if that's the case and there's residents out there like that, absolutely not. It shouldn't be mandatory. Some of them are phenomenal. Others are not. So do your research. And they're all different. Even good ones are different, good for different reasons. So just do your research.
Let's spice it up here a little bit, man. So let's talk about an avenue that we haven't talked about yet too much, and that's business. So how did going through your residency help basically you start your business?
Well, how it helped, I would say confidence in what I'm offering people. I can sit there now and look someone in the eye and say, I think I can help you in this amount of time, et cetera, since I believe I'm well-versed in what to expect out of certain presentations, which helped a great deal from the residency. I'd say it almost hurt me by saying I'm not a good salesman. I don't want to tell people to sign up for 10 visits if they don't need it to just get a massage. As far as standards go, I would never do that. So kind of tongue-in-cheek there, it didn't hurt me at all, but I would say it helped by I would never open a business, take the risk that I took opening it up if I wasn't comfortable clinically. And I realized, talking to a lot of business PTs, like you got to focus on different things, or the emphasis should be here. You're a good enough clinician. That's just not how I'm wired. I don't, you know what I mean? So it gave me the confidence to do it, even though at the time it was not, I would say at the time I would absolutely say I never would open my own business. But that changed in a couple of years, but didn't take long.
Yeah, I was going to say, it sounded like there was a pretty quick shift from unsure, unwavering, kind of shaky green thumb, greenhorn there to confident, ready to go and ready to rock my own practice.
You guys not altogether different from deciding to do the residency. Oh, there's residencies? Good, I'm going to do one. Oh, I can open my own business? Well, let's do it. Right. So it's luckily I haven't gotten bitten in the behind yet for taking that approach, but.
Well, so let's talk about the residency a little bit more. And what do you think some of the strengths were of your residency program? And what were some of the things you feel like they could have maybe done a little bit better? Yeah,
good question. So strengths, mentors plus Mary. She's technically not a mentor. So didactically, phenomenal. The collaboration, again, I'll repeat in case anyone missed it. 2 sports residents plus other mentors, 2 orthopedic residents, 2 MD fellows, and another surgical, obviously, MD fellow. And we're always working together. We're at a lot of the same, unbelievable collaboration. The whole system up there, I've never, and not that I've been everywhere now. I mean, don't get me wrong. Now I'm in the Chicago area. I've never seen an area packed so full of well-respected PTs that get along with doctors. Doctors and PTs collaborate. A lot of PTs write their protocols. That I have not seen around here at all. They've done a great job of getting the whole health system involved in the residency directly or not on the same page. And that's not just the residency's doing, I'm sure it takes the whole team to do that. But they did a phenomenal job of getting us working with a lot of people, even from other companies. They're not even all through Fairview. You're seeing private docs too that they have relationships with. And then additionally, what I think they did a very good job of, and I think this is the most difficult thing for residencies to do, because I would love to work in a residency and maybe even start one if I can in the right place. This would be the biggest challenge, and they do a good job, is having affiliation to sports teams. Because we're as a sports PT, I'm an orthopedic PT. It's orthopedics for the most part, like as far as, of course, there's neuro and stuff involved there, but it's a slippery slope to just make it an orthopedic residency and talk about sports a lot. But you're covering a football game every Friday. You're covering sporting events nearly every weekend. You're seeing some of those people that get hurt on the weekends in the clinic. They do a great job of making it a sports residency, not an orthopedic residency that, talks about sports a lot or has you present on sports. It's a sports residency, and that's tough to do. Is it perfect? No, because the trainers need a job. They're not going to let the residents take their spot. But it would be hard to do perfectly, and I don't hold that against them at all.
Yeah, no, I think that's a really good perspective. I know throughout this episode you were bringing those strengths, and I think even getting that, kind of that potential weakness or limitation or something that's maybe a barrier, shall we say, for other programs to accomplish, I think that's a really good point. So, Jake, we like to end each episode with this final question because this is kind of our big cheese here, if you will.
Sure.
So the question that we always ask is, if you could change one aspect of healthcare education, whether that be physical therapy or other healthcare provider related, which aspect would you change and how would you change it?
Eliminate my student loans. No. Of course, the finances, it comes to mind immediately. PT schools, extremely expensive, and it's getting more expensive and longer, and pay is not increasing. So that's tough. I would say I'm kind of still on the undergrad thing. I won't even say which school, but I did some interview. I was part of the interview process for a PT program. And I was shocked at kind of the surprise at students at the work that would be done. They're not prepared as undergrads for what they're really doing. And I'm just bagging on PT school too much, but I bet medical school's not full of people who don't want to work hard. I don't think we're getting the best applicants. PT school is one of the hardest to get into, and you can correct me if I'm wrong. I think you know more about this than I do. Not because it's the hardest to get into, because of volume of applications. Of course, I don't want to make it harder for people to do what they want to do, but man, I was surprised at the low expectations and low standards some people have applying, and sometimes even their first year or two, or hopefully not 3 of PT school. And I would love for the undergrad system to, I don't want to say garbage in, garbage out. We're not producing garbage, but it's almost applicable, I think, or maybe I'm being too hard, but that's what I'd change.
Yeah, and so I've been doing a little bit of adjunct teaching with Baylor's DPT program, their new program, and they actually have a pre-PT program through the undergrad there. And we haven't delved into that yet, but that might be a good future episode, would be to get somebody involved in the pre-PT program at Baylor and see what that looks like as a feeder program. Because I don't know that it's necessarily an issue going from undergrad to graduate school at the same place. I just think, it's critical thinking, and how is that being addressed?
Yeah.
Well, Jake, thank you so much for coming on the show tonight. You've been a great supporter of the show. We can't thank you enough for that. And, it's been a pleasure having you. Where can people find you on social media and online if they want to follow up and chat with you?
So my practice's website, I suppose, online is nextstepphysio.org. And then my Instagram page, which I had to have a guy at my gym help me set up because I'm so bad at this stuff still, is next_step_physio. So you can find me there. And there you go. That's all I have for social media.
Awesome, man. You'll get it. Just keep practicing, man. Just takes reps.
You got it.
All right, Jake. Thanks again so much for your time, man.
Yeah.
Thank you, guys. It was a lot of fun. Thanks, and nice talking to you guys.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.